Have you ever opened a letter from Social Security or Medicare and felt your heart sink? Maybe you saw your premiums went up, or you got a bill you didn't expect? You're not alone. Every year, millions of Americans, just like you, lose out on benefits they've earned. They pay too much for prescriptions, they miss deadlines, they get stuck with surprise costs. But it doesn't have to be this way. In 2025, there are big changes coming to Social Security and Medicare. Some will help you save money, others could cost you if you're not prepared. Today, I'll show you how to protect your benefits, avoid the most common mistakes, and make sure you get every dollar you deserve. So grab a pen, get comfortable, and let's make 2025 your best year yet. Hi, I'm Sheriff. Welcome to our channel, where we help you get the most from your Social Security and Medicare. In this video, you'll learn what's changing with Social Security and Medicare in 2025, how these changes affect your wallet, the biggest mistakes people make and how to avoid them, simple tips to save money and get better coverage, real stories from people just like you. Whether you're retired, living with a disability, or helping a loved one, this guide is for you. Let's dive in. Section number 1, 2025 Medicare and Social Security changes. Let's start with the facts. Every year, Medicare and Social Security update their rules, costs, and benefits. 2025 is no different. Here's what you need to know. Premium and deductible increases, Part A, B, D. First, the not so good news, Medicare premiums and deductibles are going up in 2025. Part A covers hospital stays. Most people don't pay a premium, but the deductible is rising. In 2025, the Part A deductible will be about $1,700, 0 cents per benefit period. That's up from last year. Part B covers doctor visits and outpatient care. The standard monthly premium is expected to rise to around $185. The annual deductible will also increase, likely to about $260. Part D is your prescription drug coverage. But premiums vary by plan, but most people will see a small increase, about 2 to 5 more per month. These changes may seem small, but they add up, especially if you're on a fixed income. New $2,000 0 cents drug cap law now. Some good news. Starting in 2025, there's a new law that puts a $2,000 0 cents cap on out-of-pocket drug costs for people with Medicare Part D. That means no matter how expensive your medications are, you won't pay more than $2,000 0 cents a year for covered drugs. This is a huge relief for anyone with high prescription costs. If you've ever had to skip a medication because it was too expensive, this change is for you. Telehealth and preventive care expansion. Telehealth expanded in 2025. Telehealth is here to stay, and it's getting even better in 2025. Medicare will continue to cover more telehealth visits, including mental health and preventive care. You can see your doctor from home, saving time and travel. Plus, more preventive services like screenings and vaccines are covered at no cost to you. Medicare Advantage plan changes. If you have a Medicare Advantage plan, pay close attention. In 2025, many Advantage plans are adding new benefits like expanded dental, vision, and hearing coverage, but some plans are also raising co-pays or changing their provider networks. It's more important than ever to review your plan during open enrollment, enrollment updates, and deadlines. Finally, there are some updates to enroll. The annual Medicare open enrollment runs from October 15th to December 7th. If you miss this window, you could face penalties or lose coverage for next year. Social Security has also updated some online tools to make applying and managing benefits easier. Don't wait until the last minute. Mark your calendar now. Section number 2, impact on Social Security. Recipients. So, what do these changes mean for you as a Social Security recipient? Let's break it down. How benefits may be affected. If you get Social Security, your Medicare premiums are usually taken out of your monthly check. With premiums going up, your take-home amount may go down, even if you get a cost of living increase. For example, if your Social Security check goes up by $50.00, but your Medicare premium rises by $15.00, you only see a $35.00 increase. It's important to check your benefit statement each year to see how much you'll actually receive. Common confusion areas many people get confused about: when to enroll in Medicare, how to pick the right plan, what's covered and what's not, how to get help with costs. Don't worry, we'll clear up these questions in the next sections. Section number 3, coverage, comparison. Choosing the right coverage can be overwhelming. Let's compare your main options for 2025. Original Medicare. Original Medicare includes Part A and Part B. You can see any doctor or hospital that accepts Medicare. You pay deductibles and 20% co-insurance for most services. Prescription drugs are not included. You need a separate Part D plan. Pros: flexibility to see any provider. No referrals needed. Costs: no cap on out-of-pocket costs. Doesn't cover dental, vision, or hearing. Medicare Advantage, Part C. Medicare Advantage plans are offered by private companies. They include Part A, Part B, and usually Part D. Many offer extra benefits like dental, vision, hearing, and fitness. You may need to use a network of doctors. Pros: all-in-one coverage, extra benefits. Cons: limited provider networks. Prior authorizations may be required. Benefits and costs can change each year. 2025 update: more plans are adding benefits, but some are raising co-pays or narrowing networks. Always review your plans. Annual notice of change. Medigap supplemental insurance. Medigap plans help pay your out-of-pocket costs with Original Medicare. You pay a monthly premium. You can see any Medicare provider. Doesn't include drug coverage. You'll need a separate Part D plan. Pros: predictable costs, no network restrictions. Cons: higher monthly premiums. Doesn't cover dental, vision, or hearing. 2025 update. Premiums are rising in some states. Shop around for the best deal. Medicaid helps people with low income and limited resources. Covers most Medicare costs plus extra benefits. Eligibility varies by state. Pros: very low or no out-of-pocket costs. Extra help with services. Cons: strict income and asset limits. Provider choices may be limited. 2025 updates. Some states are expanding Medicaid benefits for seniors and people with disabilities. Check your state's rules. Section number 4, mistakes to avoid and solutions. Now let's talk about the most common and costly mistakes people make with Medicare and Social Security, and more importantly, how to avoid them. Missing your enrollment window can cost you big. If you don't sign up for Medicare when you're first eligible, you could face lifetime penalties. If you miss open enrollment, you may be stuck with a plan that doesn't fit your needs. Solution: mark your calendar, set reminders, ask a trusted friend or family member to help. Out-of-network issues with Medicare Advantage. Seeing a doctor outside your plan's network can mean higher costs or no coverage at all. Always check if your doctors and hospitals are in network before you get care. Overpaying for drugs. Many people pay too much for prescriptions because they don't compare plans. Solution: use the Medicare Plan Finder every year to see if there's a better Part D or Advantage plan for your medications. Real life stories / examples. Let me share a quick story. Mary, age 72, didn't review her Part D plan last year. Her new medication wasn't covered, and she ended up paying $800, 0 cents out of pocket. After using the Medicare Plan Finder, she switched plans and now pays just $40, 0 cents a month. Don't let this happen to you. Section number 5, money-saving tips. Here's some proven ways to save money on your Medicare and Social Security costs in 2025. Extra Help Medicare Savings Programs, Medicaid. If your income is limited, you may qualify for Extra Help, lowers your prescription drug costs. Medicare savings programs help pay your Part B premium and other costs. Medicaid covers most out-of-pocket expenses. Even if you think you don't qualify, it's worth checking. Many people are surprised to find they're eligible using Medicare Plan Finder every year. Use the Medicare Plan Finder at Medicare.gov. Enter your medications and pharmacy. Compare plans side by side. Look for lower premiums, better drug coverage, and extra benefits. It's free, easy, and could save you hundreds of dollars. Telehealth usage. Take advantage of telehealth. No travel needed, often lower co-pays. Great for routine checkups, mental health, and follow-ups. Ask your doctor if telehealth is right for you. Section number 6, real-life scenarios. Let's look at a few real-life examples. Scenario 1, John's missed enrollment. John turned 65 but didn't sign up for Medicare Part B because he thought he didn't need it yet. A year later, he needed surgery. He faced a 10% penalty on his Part B premium for life. Lesson, don't delay enrollment unless you have other credible coverage. Scenario 2, Linda's drug savings. Linda takes several expensive medications. She used the Medicare Plan Finder and switched to a plan with better drug coverage. She saved over $1,200, 0 cents a year. Scenario 3, Carlos and Medicaid. Carlos lives on a small Social Security check. He applied for Medicaid and a Medicare savings program. Now his premiums and copays are covered and he gets extra dental benefits. Scenario 4, Susan's telehealth success. Susan lives in a rural area. She uses telehealth for her regular checkups and mental health visits. No long drives and her copays are lower. If you found this video helpful, please give it a thumbs up, subscribe, and leave a comment below. Share your questions or your own experiences. We love hearing from you. And don't miss our next video where we'll reveal the top 5 ways to boost your Social Security income in 2025. Hit the notification bell so you never miss an update. Let's recap. Medicare and Social Security are changing in 2025. Premiums and deductibles are going up, but new benefits like the $2,000 0 cents drug cap can help. Review your coverage every year. Don't miss deadlines. Use free tools and programs to save money. Ask for help if you need it. You're not alone. You've worked hard for your benefits. With the right information, you can protect them and make the most of every dollar. Thank you for watching. Take care, and we'll see you in the next video.